What it helps us to do is to understand the magnitude of the problem, both in the public and the private arena. And it helps us on a policy level to be able to assess the extent to which an intervention is successful, but also the extent to which an intervention might be worth it. In other words, it might only cost $12 billion to deal with alcohol abuse and resolve the whole issue. If that's the case, that's a heck of a deal. We can save a lot of money as a society on this. If it costs $500 billion, you might want to rethink the whole thing, right? But that's generally not the case. Because the other thing that we know about a lot of these issues is prevention. And prevention of not only the problem or phenomenon under study, but prevention of the secondary problems is the most effective. It's far more effective to prevent alcohol abuse than it is to deal with it after it already occurs. The same thing with nicotine addiction and smoking, obesity, overweight, and drug abuse, right? So, so this is kind of to anchor this in some things that we might already kind of understand. What we begin to wonder about is how do people do this, and how do we understand this? A lot of this I already went through. The other thing that we hope it does is that it helps to motivate change. It helps people to say, wow, this is really expensive. And the extent to which a policymaker, or the extent to which people are able to kind of get this into the stream of consciousness of people, are able to frame this issue in such a way that it gets people's attention, is the extent to which people say we need to do something about this issue. So it can motivate change. And again, it helps to kind of model potential cost savings that result from various possible policy solutions. So we can identify the cost of a potential policy solution. We might be able to identify the cost that it will reduce this annual cost estimate. And a lot of folks will go through and do these massive models that will help you to understand what would happen if we did this versus this with different policy solutions. We do this using 5 basic steps. And of course, this is a little more complicated than this slide might imply. This isn't something you do the night before it's due. Although we all try still. It's always amazing to me. The more education I get, the more I realize we really do everything at the last minute. So you're not the only one as a student.
True.
The first thing we want to do is we want to understand the extent of the problem. Okay, so if we use the example of alcohol abuse, how many people experience alcohol abuse? How many people might we say have an alcohol abuse problem? We're going to review the literature to first of all identify what does alcohol abuse mean? How is it dependent on alcohol dependence? How is it different than someone that has a couple beers here and there? How do we understand what that means? And the same thing goes for hunger. How do we define hunger? The second thing is to review the literature to identify the possible consequences of that particular problem. So what we may do for alcohol abuse is, what are the consequences of alcohol abuse? We can kind of go through our own minds right now and think of a few, right? Car accidents, child welfare issues, maybe productivity at work. It's a cost to society, right? Cirrhosis of the liver, medical bills. So there are several kind of consequences that we might identify. And we may start with that. The literature might help us to understand other ones. And by the literature, what I mean is, what studies have been conducted that help us to understand the possible consequences of this problem? And hopefully, the studies do a good job of controlling for other potential factors that might be influencing this consequence. Okay? So if I were to say, for example, with hunger, a child may not learn as quickly, may have more likelihood of ADHD, let's say. A child may also have that same exact problem if the family is very poor and is forced to live on a very busy street with lots of road noise all night long. So we want to make sure is that the literature that identifies potential consequences are controlling for some of these other factors that may not be related to the specific issue that we're talking about. Okay? I want to get to that again later on. Alcohol abuse is another good example, right? We want to make sure that people with alcohol abuse are more likely to smoke pot. And what we're actually seeing is that the car accidents are caused by people smoking pot. I'm not saying that's the case, but if it's the case, you want to make sure that the studies are doing a good job of controlling for other potential factors that could lead to this consequence, right? We also want to be able to identify studies that show us that the consequence is greater for those with the problem under study than those without the problem under study. It may be, for example, that just as many people that don't have alcohol abuse are having car accidents than people that do have alcohol abuse for some reason. Right? And another example might be is depression. What we know is people that abuse alcohol are more likely to experience depression. But we want to be able to find solid research literature that shows us this to be the case. The same thing with hunger. Right? But we want to make sure that people that are hungry are experiencing this at a greater rate than people that are not hungry. If they're both the same, you can include them in the model, but you're not getting anything there. Because what we're looking for is the difference there. We're looking at the difference between people that don't experience this problem and people that do. Right? You also want to identify in the literature the cost of each of these things. So what's the cost to society of depression? Right? So we have the problem, overall problem of hunger, the consequence is depression. Now what's the cost of depression? Okay? And then we want to calculate the cost of depression that's attributable to just that problem. And then for each of the consequences that you've identified, sum all those up. Right? In the end, what I'm saying here is that all of this is based on our capacity to identify literature that does each of these things, right? Which is not in itself easy, which is why our numbers are very low in the end. There's not a lot of literature on the full impact of hunger. That's quantitative in nature, and that's pretty good. There's a lot out there, but is it quantitative? And does it kind of help to kind of give us the likelihood ratios and stuff that we need for the modeling that we're going to do here, okay? So let's go through each of these steps right now. Are we okay to do that? Are people kind of, so it might be a little confusing right now, but we'll catch up, right? Now let's talk about the extent of hunger in America. So I'm looking at the very first point here, right? What's the extent of the problem and how do we measure that? Before I move into this, one of the things that I think is important to state, and one of the assumptions that we made, is that hunger is not about individual choice. And although when you look at these other conditions, we're realizing that these conditions are far more complicated than we ever thought, right? People don't just pick up a drink. People don't just pick up cigarettes. There are other things going on that have to do with the environment, that have to do with genetics, that have to do with all kinds of other kind of family issues and everything else. It's very complicated. We're not talking always about individual choice. But one of the things that we know about hunger is that people do not choose to go to bed hungry. People do not choose to put their children to bed hungry at night. All right? So hunger is not about kind of individual choice. It's involuntary on the part of its victims, and it's quite preventable by society as a whole, but it's based on larger kind of economic structures. So although this point kind of falls apart in my mind, because of my belief that these other things that we're seeing more and more are about other conditions in the environment and in the individual. It's not just about simply choosing to do one of these events. We want to be clear that one of our assumptions is hunger is an involuntary event. So first we're going to define kind of hunger. And hunger has a history that dates back to the late 60s, at least as far as kind of a national response with the Citizen Board of Inquiry into Hunger and Malnutrition. And this was largely comprised of physicians and clergy. And it came up to about 10 million people were identified across the country as being hungry. And this was a big shock. And the other big shock was that this is an endemic problem. It's a much bigger problem than was ever previously expected. And this prompted congressional hearings, and this is kind of where we see the rise of WIC programs, the school breakfast program, elderly feeding programs, the national food stamp program, and stuff like that. So that's kind of the very kind of beginning, if you will. We could go back farther into history. We could, and certainly not doing this history issue justice. In 1985, we'd see the Physician Task Force on Hunger in America come out with a report that puts more like on $20 million. What was different about this particular group is these were folks that were trained. They were academics, and they were trained on kind of how do we measure this issue, and how do we measure this problem.